right, good morning. Thank you so much for joining us this morning. We want to provide a COVID-19 virus update. To my left, we have Morgan County Commission Chairman Ray Long. To my right, Nat Richardson, CEO of Decatur Morgan Hospital. We are also joined by our city council members, to include our council president, Pro Tem, and District 4. We have with us our district attorney, Scott Anderson, Chamber of Commerce CEO, John Seymour, Dwight Satterfield, Assistant Superintendent to Decatur City Schools. We are represented by our Fire and Rescue Department, as well as our Decatur Police Department, First Response, EMS, Lifeguard EMS, and 911. I certainly hope that I have not left out anyone, and as well as members of our community. I have a brief statement to read, and then Mr. Richardson with our Decatur Morgan Hospital will share, and then we'll take just a few questions. The City of Decatur and Morgan County are committed to providing residents with the latest updates as we continue to diligently monitor the impacts of COVID-19 in our community. With confirmed cases in Alabama, the Morgan County Infectious Disease Task Force, of which the City of Decatur and Morgan County is a member of, has met several times and reviewed our unified response plan in the event that we need it. As a municipality, we train and prepare for a variety of situations that we may face, infectious diseases being just one of them. If we do happen to see a significant amount of COVID-19 cases in our area, we will continue to provide uninterrupted governmental services to the best of our abilities to minimize any impact on our residents, local businesses, and organizations. This is a time of personal preparedness for all of us. To help our families and neighbors remain healthy, we ask that our community follow a few simple guidelines. Stay home if you feel unwell. Cover your coughs or sneezes with tissues. Wash your hands often. Stay tuned to the Alabama Department of Health's releases and the official social media pages for the City of Decatur, Decatur Police Department, Decatur Fire and Rescue, and those of our regional partners of the Morgan County Infectious Disease Task Force, to include Morgan County EMA, Morgan County 911, Morgan County Sheriff's Office, Alabama Department of Public Health, Decatur Morgan Hospitals, Decatur, Hartselle, Morgan County Boards of Education, Hartselle Fire and Rescue, First Response EMS, and Lifeguard EMS. That concludes my statement.
Welcome everyone. As you all are aware, hospitals across our state and across the nation have collaborated quite well on making sure our hospitals are ready, not only to take care of the patients that we serve on a day-to-day basis, but the team members who serve within those hospitals, as well as making sure any guests that are coming into the hospitals are protected and we protect our community. One of the things that we have done in our hospital, specifically in Morgan County, is making sure that we have social distancing. We have limited the number of guests that can come into rooms for the various patients that they're visiting. We are making sure that our team members have protective equipment when they are dealing with patients who might have a suspected virus, and we're making sure that we control all our access points in the hospital. So we are trying to look at which doors make sense to be locked down so that people are just not going in and out of any doors throughout the hospital. And those are some of the things that we have done just initially. We're following the CDC guidelines as well as the Department of Health and any guidance we get from the federal level agencies to make sure as things change and we learn more about this virus that we can change our protocols and change any of the infrastructure that we have in place now to protect our public, the patients, and our team members within the hospital. We plan to continue to update those on a day-to-day basis as we learn more information. As you know, this virus, we're learning more about it each day, and as we continue to get more information, we'll have to change how we set up our infrastructure.
Thank you, Nat. Chairman Long does have a brief statement.
It'll be real brief. You know, this, as Nat said, this thing is changing rapidly. We really don't know all we need to know about it, and won't know this time next week, but it's learning. And so at the county, we're just like everybody else. We want everybody to stay safe all they can. You know, don't come to the courthouse if you don't have to, especially if you're sick, stay at home. But we'll be meeting with department heads and our other elected officials that operate through the courthouse here later on today, just to find out what everybody's concerns are. We know different counties around Madison County, their courthouse is closed today to the general public. We expect some of the other courthouses to do the same, but we hadn't made that final decision yet for Morgan County. But we will be meeting with department heads and elected officials sometime later on this afternoon to see what measures we need to do. You know, we, as the mayor said and Nat said, you know, the safety of the citizens is real important, but also the safety of our employees. You know, every government has employees, and we have good things and bad things, but our employees are the best asset that we have, and so we're going to do what we can to take care of our employees, and of course we want to take care of the citizens too. So we'll be having more information, I'm sure, throughout the day on that as this thing changes really by the hour. And so thank you.
So we'll take a few questions.
Have you guys had any patients so far tested for the coronavirus in your hospital?
Yes, we have. We're currently under, there's 4 patients that are currently under investigation as we speak.
Any other patients been tested positive for the coronavirus yet?
No positive test confirmed at this moment.
Are you struggling to test people with the lack of tests, or is it getting better kind of as we continue?
We feel it has gotten better, and we are able to get the tests. As long as we can get them to the testing site, they don't seem to at least be at this point overwhelmed with the ability to get us the results back within 24 to 48 hours.
In Huntsville Hospital, as a system, held a press conference Friday. They said they're working to set up kind of pop-up shops and drive-throughs for people to go and have easily accessible testing, you know, without contaminating one another in a doctor's office or a hospital. Do you anticipate that that's going to be also done in Morgan County?
Yes, we have a meeting scheduled this afternoon. We have identified a couple of spaces that we could provide that off-testing at. We have not confirmed it, but we're talking about it now.
Have you changed the staffing number at the hospital, increased, decreased?
Right now, we have not changed the staffing numbers. Our volume has not increased to a level where we feel like we have to add additional staff at this point, but we do have the capacity if that was necessary.
Are you good on supplies, hand sanitizer, gloves, masks, stuff like that? I know there's been issues with people kind of coming into hospitals and just taking them.
Yes.
So kind of update us on where you're at with that.
So we have limited the number of masks that we put out in the lobbies and hand sanitizers because the public, out of their consternation over the virus, they have been taking those supplies, and we now have reduced the number of supplies we put in the lobbies. We feel like we're okay on the logistics side to take care of the patients and our staff members with the current supplies we have.
When do you anticipate getting those test results back for the 4 people under investigation?
We should get them back within the next 24 to 48 hours. We just submitted our test results over the weekend. Again, they have to go to Montgomery and certain testing labs, so it takes time to get there. And once they are there, it takes about 24 to 48 hours to get the results back.
And where are they located right now? Are they in the hospital, self-quarantine?
Yes, so those 4 patients, we do have 4 that are in the hospital. We discharged 1 patient yesterday, and they will remain in the hospital until we get the results, and or we feel that they can go home and stay in a quarantine environment until those results are received from the state.
So they're in isolation right now, just in a room?
That's correct.
From a medical perspective, can you explain the importance, the younger population isn't necessarily at risk, but they do pose a risk to other people in the community. Can you explain the necessary means for social distancing, even though it doesn't, people think it doesn't apply to them?
Right. Well, from the guidance that we've received from the CDC as well as the Department of Health, that's the guidance we are following as well, that even if you're young and you don't feel like you have, you're carrying the disease, you could be carrying it, and we would like for anyone who feel like they are symptomatic that they stay away from the distance, stay within the distance requirement that the CDC and the Department of Health is recommending.
So we're going to shut her down. Thank you so much for joining us today. And as we have additional updates, we will send those to you. Thank you.
Any more statements to just reassure the public, people of Decatur, Morgan County?
I think we've covered everything, Jim. Thank you.